Speaking about the rheumatology, the clinical features are lupus dermatitis. The first one is your lupus dermatitis. Speaking of a lupus dermatitis, where you see the malar or discoid rash, where you see the malar or discoid type of rash, you may see that classical butterfly type of rash. And apart from that, you may see the severe photosensitivity. You may see the severe photosensitivity, oral ulcer, and arthritis, which is a non-erosive type. And apart from that, several systemic complication, people. Several systemic complications. And speaking about the systemic complications of your lupus nephritis, wire loop lesion is associated with the lupus nephritis. Wire loop lesion is associated with the lupus nephritis. In the brain, it can able to produce the seizure and the psychosis. In blood vessels, TIA, stroke, and myocardial infarction. TIA, stroke, and myocardial infarction. Lungs, interstitial lung disease, diffuse alveolar hemorrhage, ILD and diffuse alveolar hemorrhage, and cardiac pericarditis, myocarditis, and Lippmann Sachs endocarditis, and GI, increase in ALT and AST. Increase in ALT and AST. Apart from that, antibodies in SLE, we are having a ANA, anti-Smith antibody, anti-phospholipid antibody, anti-double-stranded DNA antibody, and anti-histone antibody. Anti-histone antibody is a very specific one for drug-induced lupus. Drug-induced lupus. And drug-induced lupus, what are the drugs which can able to cause the SLE? There are lot and lot. There are lot and lot. For example, anti-arrhythmic like procainide, disopramide, and propafenone. Anti-hypertensives like hydralazine, ACAs, and beta blockers. Anti-thyroid like propylthiouracil. Antipsychotics like chlorpromazine and lithium. Anticonvulsant, carbamazepine, and phenylate. And antibiotic, INH, minocycline, and nitrofurantoin. Sulfasalazine, hydrochlorothiazide, and lovastatin and simvastatins can able to produce SLE. Lovastatin and simvastatin can able to produce SLE. Treatment, high dose glucocorticoid. Apart from that, mycophenolate mofetil and cyclophosphamide will be there. High dose glucocorticoid along with the mycophenolate mofetil or cyclophosphamide we can able to give. If there is no response, then you can give a monoclonal antibodies like belimumab or rituximab, or maybe the calcineurin inhibitor, or maybe the calcineurin inhibitors you can give for the SLE. So SLE is one of the topic of interest where you may expect at least one question, people. Where you may expect at least one question. Then you have a rheumatoid arthritis. Speaking about the rheumatoid arthritis, female, middle age, morning stiffness and pain is a classical symptoms of rheumatoid arthritis. Female, middle age, morning stiffness and pain. Apart from that, nodular rheumatoid arthritis, splenomegaly, neutropenia, that is Felty syndrome. Nodular rheumatoid arthritis, splenomegaly, and neutropenia, Felty syndrome. Rheumatoid factor positive, anti-CCP positive, that is a positive factors for your rheumatoid arthritis. Investigation of choice is MRI. Plain X-ray shows a periarticular osteopenia. Periarticular osteopenia associated with the HLA, DR1, HLA, DRL1, and DMARD of choices, methotrexate. And DMARD of choices, methotrexate. Then you have a systemic sclerosis, multisystemic disorder, like a fibrosis of your skin, blood vessel, and visceral organ. So speaking about the fibrosis of your skin and blood vessel, since it is an unknown cause skin, it can cause a subcutaneous calcinosis, and blood vessels, Raynaud phenomena, lungs, diffuse interstitial fibrosis, atrophy of muscularis, and you may see the kidney renal failure, okay, associated with the systemic sclerosis. Then you have a sarcoidosis, accumulation of T cells and mononuclear phagocytes in various tissues. Pathological findings, sarcoid granuloma, and inclusion bodies will be there. What type of inclusion bodies? Shaman bodies, asteroid bodies, residual bodies. Shaman bodies, asteroid bodies, and residual bodies. And the criteria, Scadling criteria, and lambda sign on gallium-67. Scadling criteria and lambda sign on gallium-67 scan. And treatment of choice for positive symptom, prednisolone combined with the steroid sparing agent, cardiac catheter ablation or ICD implantation, neurosurgical management. Neurosurgical management you have to do for the sarcoidosis. So positive symptoms, prednisolone can be treated with the steroid sparing agent. Along with the cardiac, catheter ablation or ICD, we can able to place, and neurosurgical management is the one. Asteroid bodies, shaman bodies, and residual bodies are seen in sarcoidosis. Very, 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 very important. Shaman bodies, asteroid bodies, residual bodies, sarcoidosis. Carding criteria and lambda sign, sarcoidosis. Cardling criteria and lambda sign, sarcoidosis. Another important MCQ that you have to remember. Another important MCQ that you have to remember in terms of your rheumatology.